So the objectives of the Dental Jungle project in the beginning were for me to apply some principles of psychology that I was busy teaching. And I teach in health psychology with particular emphasis on the impact of the environment and looking at stress and anxiety. So I wanted to use some of these principles to reduce children's dental anxiety, quite specifically, through a computer game. And that it would run a series of covert things. I had sort of visions of some little character jumping around doing an anxiety assessment, but also telling us something about how that child liked to cope, about that child's oral health beliefs, and then later as the project developed, what children would like to ask the dentist that they never do, the questions they've got on their mind when they come in, but because they're jumping up in the chair and they've got the bib on and they're laid back, they feel that they can't ask anything, just the kind of scripted hello, how are you things, and really they've got a lot of questions they want answers to. The cognitive development oral health belief division that I've got on this slide was really because I thought to begin with that one of the crucial variables would be not so much the child's age as cognitive, how their thinking had developed, because there's previous work on children's understanding of diseases, and obviously it develops over time, and young children see disease in a magical way as a punishment and so on. Older children have a very concrete understanding, sort of 6, 7, 8, 9-year-olds, and then beyond that they can see much more abstract cause and effect, their role in something like oral health. So I thought that age wasn't a very good indicator of cognitive development, and that possibly not of oral health beliefs either, and I thought that would be a crucial part of the project. But as we'll see as I go along, some of these things changed because the children told my students a different story. So the theory that I had in mind before we really got going was first and foremost behavioural theory. For any of these things, if as a dental audience you want to find out more about, it's really easy just to Google. Wikipedia will tell you anything, and you could put in behavioural theory. It comes from the 1950s or post-war America, where people like Skinner were doing a lot of work with rats and pigeons. And